My name is Tracy Cundiff. I'm a fifth semester nursing student. I'm going to do a health history video today with my patient. It is February 21st, 2018 at approximately 9:26 p.m. So, hi, my name is Tracy. I'm going to be your nurse today. Can you tell me your name and your date of birth?
Chase Cundiff, 11/21/85.
Okay, Chase. So can you tell me what brings you in today?
I've been having some pretty serious headaches for about a week.
Okay, and on a scale of 0 to 10, about how bad are those headaches?
About a 7.
About a 7. And have you been taking anything to help?
I have, but it hasn't helped.
Okay, have you tried using sort of heat or ice or a darkened room or?
I usually shut off the light, and that seems to help.
That seems to help. Have you been seen for migraines or headaches before?
I have not.
Okay, and how long have they been going on?
About a week.
I mean, it'd be before this week. Have you had them for most of your lifespan, or have they just recently started happening?
They're pretty recent.
Pretty recent. Okay. Do you take any other medications at home?
Do not.
You don't take anything over the counter?
No.
Okay. Any herbal supplements?
No. I take a daily multivitamin. That's it.
Okay. How about any allergies? Do you have any drug allergies?
No.
Any food allergies?
No.
Any environmental allergies to anything? Okay. Can you tell me a little bit more about your medical history, any surgeries you've had in the past?
Yeah, I've had 3 surgeries. I was diagnosed with ulcerative colitis in 2008. They did a colectomy and then built a J pouch out of the end of my small intestine and reconnected it. I had 3 surgeries on my right ear. When I was in 2nd grade, they went in and removed a cholesteatoma, and then I had 2 reconstructive surgeries, and I still have a hearing loss in my right ear. And when I was in college, I broke my left leg, so I've had 2 surgeries on my left ankle.
Okay. Do you still experience pain or anything like that with your ankle or your knees?
It still gets stiff.
Stiff. Does it get swollen or red?
Occasionally.
Okay. How about any other medical history? Like, do you have high blood pressure? Anything like that?
I do not.
Okay. You're up to date on your vaccinations?
I am.
You got your flu vaccine this year?
I did.
Okay. Can you tell me family history? Like, do you have a family history of cancer, hypertension, or?
I have a family history of high blood pressure. Both my mom and my brother. I've got dementia with grandparents on both sides. And I think that's it.
Okay. What do you do for work currently?
I am a reactor operator in training at the nuclear power facility outside of Fulton.
Okay. And you enjoy that job?
I do.
Okay. Do you exercise on a regular basis?
If you consider chasing a 2-year-old around exercise, I do.
Okay. I would consider that exercise. Do you get out and socialize often?
I do. Well, not often. I have a 2-year-old, so I have responsibilities, but I get to go out with my friends on occasion.
Okay, good. So fairly healthy lifestyle, you feel like?
I think so.
Okay. I'm just going to ask you a few more sort of in-depth questions about just different systems in your body, like your heart and your lungs and stuff like that. Is that okay?
That's okay.
Okay. So have you had any recent weight changes, any gaining or losing of weight?
No.
Okay. Have you noticed any sort of fatigue or any sort of fevers that are abnormal for you?
No.
Okay. Any muscle weakness, any difficulty lifting or moving like you normally do?
No.
Okay. How about any rashes? Have you had any skin rashes lately?
No.
Any skin lesions that you're concerned about?
No.
Moles that have changed shape or size?
No.
Okay. Has your hair changed at all lately? Has it become more dry? Has it started to fall out? Haven't noticed any bald spots or anything like that?
No.
Okay. And you said you were having headaches. Have those headaches affected your vision?
Sometimes I see spots.
Okay. Do you actually currently wear any sort of corrective eyewear?
I do. I wear contact lenses.
Okay. I know you said you lost your hearing and was it the right ear?
Right here.
Okay. Do you wear a hearing aid?
I do not.
Okay. So you don't use any sort of corrective devices at this time for that?
No.
Okay. And do you get frequent colds or sinus infections?
No.
Okay. So we're all around fairly healthy.
I like to think so.
Good. What about your neck? Do you have any stiffness or pain in your neck?
I do not.
Okay. Have you ever been diagnosed with a goiter, a large swollen goiter in the front of your throat?
No.
Okay. Do you ever feel short of breath? Like it's hard to keep your breath? Any history of coughing up blood?
No.
Okay. You've never been diagnosed with asthma or bronchitis?
No.
Recent diagnosis, pneumonia?
No.
Okay. Good. I know you said you had a family history of high blood pressure, but you don't currently have that disease, correct?
That's correct.
Okay. Have you ever been diagnosed with a heart murmur or arrhythmias?
No.
Okay. Ever had sort of tingling or numbness in your toes or fingers?
No.
Okay. And have you ever been diagnosed with like a venous ulcer in your leg?
No.
Okay. Any edema in your feet? Any swelling, painful swelling down in your feet?
No.
Good. Do you suffer from heartburn on a regular occasion?
No.
Okay. You ever have constipation or diarrhea on a regular basis?
I was diagnosed with ulcerative colitis, so I battle diarrhea constantly.
Okay. About how many wet stools do you have a day?
6 to 8.
6 to 8. But you stay hydrated fairly well with that?
I do.
Okay. Good. Have you noticed any alterations in your appetite, that you're more or less hungry than normal?
No.
Good. You've been able to maintain weight for the past several months?
Yes.
Okay. So moving on from there, I'm just going to talk about your urinary system. So do you have any frequency or burning or urgency when you go to the bathroom?
No.
Okay. Haven't been recently diagnosed with a UTI?
No.
You don't have any pain in your side or back?
No.
No? Good. You said you hadn't noticed any overall weakness. Have you ever noticed any muscle weakness on one side or the other?
No.
Good. Do you have any joint pain or any knee or hip pain?
No.
Okay. Haven't noticed any redness or swelling in your hands or feet?
No.
Okay, good. What about dizziness with your headaches? Have you had any dizziness?
I have not.
You never fainted or passed out?
No.
Okay. Have you ever noticed any sort of loss of feeling on one side of your body or the other?
No.
Any tinglings like pins and needles?
No.
Okay. Do you bruise easily?
No.
Okay. Have you ever been diagnosed with anemia?
No.
Okay. Do you have a history of any blood transfusions?
I do.
Okay. And you didn't have any adverse reactions to that? You didn't have a rash or?
No.
Okay. Good. Would you consider yourself intolerant to heat or cold?
No.
Okay. Do you ever notice that you're excessively thirsty or hungry?
No.
Okay. Do you sweat excessively? Do you soak a shirt through?
No.
Okay, good. The last set of questions I have is just more about mental health than physical. So do you have on a regular basis any nervousness?
No.
Any anxiety?
No.
Okay. You ever suffered with depression?
No.
Ever had any suicidal thoughts?
No.
Okay. Have you ever been diagnosed with any other mental illnesses?
No.
Bipolar, schizophrenia?
No.
Okay, good. Those are all the questions that I have. So we'll try to pull a physician in and have them take a look at you, see if we can't get you diagnosed, and maybe get you some pain meds that'll give you some relief, okay?
Okay, thank you very much.
You're welcome.